Okay, today we will be performing a head and neck assessment. First, I'm going to perform hand hygiene. Hi, my name is Joe Ingram. I'm a student nurse at the University of South Alabama, and today we'll be performing a head and neck assessment. Alright, I'm going to start off by observing your head. It is normal cephalic. Your eyebrows, eyelids, nose, they're all visible and present. Your lips and ears are also there. They're all symmetrical. Your nose is midline. Okay, and then we're going to move on to the hair and scalp. Is it okay if I palpate your scalp? Alright. I'm going to look for any lesions. Is there any pain or tenderness?
No.
Alright. Your hair color is a dark brown, almost a blackish color. You have clean hair, good hair hygiene. There were no lesions, abnormalities, and there were no bugs. I'm going to move on and test cranial nerve number 5, which is your trigeminal nerve. To do that, I'm going to want you to clench your jaw. I'm going to palpate. Alright, you have good muscle strength. The motor portion of cranial nerve number 5, which is the trigeminal nerve, is intact. And now to test the sensory portion, I'm going to ask you to close your eyes. I'm going to take this napkin and touch it to your face. And whenever you feel it, I want you to tell me now.
No. 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 No.
Alright, so the sensory portion of cranial nerve number 5, the trigeminal nerve, is also functioning intact. We're going to move on and test cranial nerve number 7, which is your facial nerve. I'm going to test the motor portion first. I'm going to ask you to make a few funny faces. I'm going to ask you to smile, frown, puff your cheeks. Okay, I want you to raise your eyebrows, and then I want you to squint your eyes closed and try and keep me from pulling them down. Alright, so the motor portion of your facial nerve is intact. We're going to move on to the sensory portion. I'm going to give you one sweet and one salty thing to taste, and I want you to tell me which one is which. So I want you to go ahead and close your eyes. And this is the first one.
Sweet.
Sweet. Alright, you done with that one?
Yeah.
You can go ahead and swallow. Alright, so we can move on to the second one, and you can tell me if this one is sweet or salty.
Salty.
Salty? Alright. So we're going to move on and test your eyes. I'm going to look at them. Okay, your bulbar conjunctiva is clear and white, which is good. I'm going to touch your eyes and just... Alright, your palpable conjunctiva is pink and moist, which means that it's healthy. Your eyebrows, eyelashes, eyelids are all present. You have an overload of limbus, which is good. Your eyelashes flow outwards. There are no signs of ptosis, sclera, and your sclera is white, and there's no signs of jaundice or any redness in your eyes. Okay, I'm going to assess Perlac, so I'm going to take my pen light and look at your pupils. Alright, your pupils are about 6 millimeters in size, equally bilaterally. They're symmetrical. Okay, I'm going to go ahead and move to the pen light reflex. I'm going to take this pen light and shine it into your eye and test to see if there's any constriction with your pupil. So here's the first one for your left eye. Okay, the pupil constricted. I'm going to do that again and look at your right eye. Alright, both eyes constricted bilaterally. I want you to now look at the TV. And I can fix that in post. I'm going to bring this pen light in, and I want you to focus on it. Okay, as it got closer, your eyes did converge on the pen, which means that you're aware of what you're looking at and you can focus. Okay, your eyes did turn on an axis, which means that they have convergence. Alright, we're now going to do the 6 cardinal points of gaze. I'm going to take this pen light and I want you to follow it with your eyes, but not your face. had parallel tracking in both eyes, which is good. There was no nystagmus, which means that your cranial nerves 3, 4, and 6 are all functioning intact. That's your oculomotor, your trochlear, and your abducens. They're all intact. Now I'm going to do the corneal light reflex. To do that, I'm going to shine this light at the bridge of your nose. Alright, there was equal shine on both bilateral corneas, which means that both eyes are working properly. I'm now going to test your visual acuity. Normally we would use the Snellen chart, which would be about 20 feet away. You'd stand on this line, and I'd get you to cover one eye and read the lowest line that you can. But today we're going to use a handheld screening chart. So I'm going to put this about 14 inches from your face. I want you to cover your left eye and read the lowest line you can.
3, 7, 4, 2, 5, 8.
Okay, you read this line, which sits at 20/30, which means at 20 feet you can see what a normal eye can see at 30 feet. Okay, I'm going to measure this again, and then I want you to do it the same with the other eye. Alright, cover your other eye. Go ahead and read the lowest line you can.
3, 7, 4, 2, 5, 8.
Alright? It's the same line, 20/30, means that with that eye at 20 feet you can see what a normal eye can see at 30 feet. Okay, I'm now going to move on, testing your ears. I'm going to palpate, and I want you to tell me if there's any pain or tenderness.
Nope.
No? Okay. We're going to... Your helix, your antihelix, your antitragus, your tragus, and your labial. Right? Any pain or tenderness?
No, just tickle.
Okay. And you do have one piercing.
Yes, I do.
Your external auditory meatus has no signs of redness or drainage, and you said there was no pain and tenderness at all?
Nope.
Alright. Now we're going to test your hearing. I want you to cover one ear. I'm going to whisper a word to you, and I want you to repeat it back to me.
Oculomotor.
Alright. I want you to cover the other ear, and we're going to do this again.
Eye.
Okay, so you clearly identified both of the whispering words, which means that you do not have a high frequency hearing loss. Okay, we're going to move on to testing the nose. I'm going to palpate, and I want you to tell me if there's any pain or tenderness.
No.
No? Okay. Your nose is in the midline, and there are no abnormalities. Okay, I'm going to look at your nares. They're equal in size, and they're symmetrical. I'm going to look up your nose again, and okay, your nasal mucosa is pink and moist, and I can't see them, but if I could, your turbinates would be a beefy red color, and there would be no deviances in size or anything. Alright, we're going to move on and test cranial nerve number 1, which is your olfactory nerve, and to do that, I want you to cover up one nair and sniff. Alright, cover the other one. Sniff. Alright, so patency was present, and now I want you to close your eyes. I'm going to give you a scent to identify. So cover up one of your nares. Sniff.
Orange.
Alright, so I want you to cover up the other one, and this is the second scent.
Hand sanitizer.
Alright, so you identified both of them. That means that your nose is functioning properly. We're now going to identify and look at your mouth. So your lips are pink and moist, and I want you to go ahead and open your mouth for me. Alright, your buccal mucosa is also pink and moist, which means that it's healthy. I'm going to ask you, did you get any wisdom teeth removed at all?
Nope.
No? So you have all 32 teeth present. Can you open your mouth again for me? Alright, your teeth are straight, they're white, they're healthy, you have proper dental hygiene. Can you stick your tongue out for me? Alright, your tongue is midline, it's pink and moist, which means that it's healthy. Can you touch the tongue to the top of your mouth? Alright, I can clearly see the veins, and the posterior side of your tongue is pink and moist. Can I ask you to open your mouth one more time? Alright, your hard palate is anterior to your soft palate, and your soft palate is posterior to your hard palate, and they're both pink and moist, which means that they're healthy. Can you stick out your tongue and say ah for me?
Ah.
Alright, Your uvula rose with phonation. And did you have your tonsils removed?
No.
No? Okay, can you open your mouth and stick your tongue out for me? Alright. They're grade A2. So now we're going to move on. We're going to go ahead and test your lymph nodes. You've got your preauricular, your postauricular, you've got your occipital, your submandibular, your tonsillar, your submantle, you've got your superficial cervical, your posterior cervical, and your deep cervical. Can I ask you to hunch your shoulders real quick? Okay, we've got your supraclavicular, and that concludes the lymph nodes. None of them were palpable, which means that there was no pain. Was there any pain or tenderness to any of them?
No.
All right. So we're going to move on and test your cranial nerve number 11, which is your spinal accessory nerve. To do that, I'm going to ask you to hunch your shoulders and fight against me. All right. Turn your face one or the other. Fight against me. All right. And the other. All right. So your cranial nerve number 11, your spinal accessory nerve, is intact and functioning properly. This concludes our head and neck assessment.